Good morning, ma'am. Good morning, sir. Today po, we will be reporting the prenatal care, labor and delivery, and the last one po is yung postpartum care or postpartum period. First, dun po muna tayo sa prenatal care. So, what is prenatal care? Prenatal care is a healthcare provided to a woman during pregnancy. Ideally, prenatal care should begin before pregnancy. Ito po yung pangangalaga sa kalusugan na binibigay po ng physician sa isang babae during pregnancy. Kasama na rin po dito yung pagbisita sa hospitals for check-up po ni mother and the baby. Nag-uumpisa po dapat ang prenatal care pagbuntis ang isang babae para po may idea si mother kung paano naaalagaan yung sarili niya and para na rin po sa safety nilang dalawa. So the next one po is basic components of prenatal care. Early and continuing risk like complete history, physical examination, laboratory test, and assessment of the fetal growth and well-being. And then yung health promotion po. And the last one po is yung medical and psychosocial assessment, interview, and follow-up care. Katulad po ng treatment of existing illness and provision of resources. Who can you go to for prenatal care? The first one po is yung obstetrician gynecologist. Ito po yung licensed doctor or physician na nangangalaga at nagpapanganak sa mga pregnant woman. The second one po is yung family physician. This is a doctor po na kayang mangalaga ng family member. He or she can also take care of a pregnant woman bago or pagkatapos manganak. And then the third one po is yung MFM or maternal fetal medicine. Ito po yung specialist po na nag-handle or nag-take over po sa mga high-risk pregnancies. CNM or Certified Nurse Midwife, also known as komadrona na mayroon pong education and training background. Same lang din po na nag-aalaga ng pregnant woman. And then yung FNP or Family Nurse Practitioner, same as a family physician po na nag-aalaga ng mga babae. Dito naman po is kahit anong edad, including na rin po yung mga babaeng buntis. Schedule of visits. Week 4 to 28 of pregnancy, 1 check-up. Every 4 weeks, which is once a month. And then yung weeks 28 to 36 of pregnancy, 1 check-up. Every 2 weeks, which is twice a month. And then yung weeks 36 to 41 of pregnancy, 1 checkup every week, which is once a month. Visit may also include taking routine tests and screenings such as blood tests to check for anemia, HIV, and also blood type, monitoring the blood pressure, measuring the weight gain, monitoring the baby's growth and heart rate, talking about special diet and exercise. Importance of prenatal care. To ensure the safety of the mother and the baby during pregnancy. Alam naman po natin na di maiiwasan na minsan mayroong complication during the pregnancy ni mother. Para na rin sa safety ni patient na if ever man na may complication, mas maaagapan po and masusolusyonan. Ito na po sa labor and delivery. Although each labor and delivery are unique, most follow a similar pattern. As a result, a pregnant woman can have a broad understanding of what will happen to her body in order for her to deliver the baby and what procedures will be used to assist her. Dito po sa part na to, need po natin explain kay mother para po mag-participate po si mother and maintindihan yung pwedeng mangyari sa body niya para po ma-deliver si baby ng safe and maayos. What is labor? Labor is a series of continuous progressive contractions of the uterus. Ito po yung progressive contractions ng uterus to help the cervix to open or dilate. And to din po yung phase to allow the fetus to move through the birth canal. Labor usually starts po 2 weeks before or after the estimated date of delivery. Signs of labor. Bloody show. A small amount of mucus is slightly mixed with blood may be expelled from the vagina, indicating a woman is beginning to labor. Contractions uterine muscle spasms occurring at intervals of less than 10 minutes and usually indication that labor has begun. rupture of amniotic sac or bag of waters. Labor sometimes begin with amniotic fluid gushing or leaking from the vagina. According po to some articles that majority of women with ruptured membranes is nagle-labor po within 24 hours. Different stages of labor. First stage is dilation, and this stage has 3 phases. The first one po is the early phase, is also called the latent phase. It is the longest and can last up to 20 hours, especially po sa mga mothers na first time pa lang magbuntis, and typically po ang early phase labor usually po nag-uumpisa sa contractions coming every 5 to 20 minutes and lasting for 30 to 60 seconds each. The second one po is yung active phase. After po mag-dilate ng cervix to around 3 centimeters, dito na po mag-start yung active phase. And transitional phase. During transitional phase po, expect na po natin na yung cervix is mag-open to about 8 to 10 centimeters, which is 3 to 4 inches po para malabas si baby. The second stage po is, usually po tumatagal po to between 20 minutes to 2 hours sa mga first time magbuntis. And this stage po of labor, pag yung cervix po is fully dilate to 10 centimeters, ready na po ilabas si baby. Third stage, ito po yung stage na tapos na po mga anak si mother, and after po nun, ipupush out po yung yung placenta through the vagina, and typically po this occurs between 5 to 30 minutes. Induction of labor. In some cases po, labor has to be induced, which is process of stimulating. Some common reasons for induction include the following. The mother and the fetus are at risk. The pregnancy has continued too far past the due date. The mother has preeclampsia, eclampsia, or chronic hypertension. Diagnosis of poor growth of the fetus. Care at the hospital during labor. The nursing staff may perform the physical examination of the abdomen to determine the size and position of the fetus. And the last one po is to examine the cervix. In addition, the nurses may check the following: blood pressure, weight, temperature, frequency and intensity of contractions, fetal heart rate, and the last one po is urine and blood samples. Venous fluids. Intravenous fluids are usually given you during labor. Dito po ini-inject yung mga medications. Intravenous fluids are usually given once active labor has begun, and are also needed when a woman has epidural anesthesia. Pain management options during labor. Generally, mother and their doctors or midwives want to use the safest and most effective method of pain relief for both mother and baby. The choices will be determined by patient and family preference, the health of the patient, the health of the fetus, and the doctor's recommendation. Pain management. Non-medicated measures provide comfort, relieve stress, and sometimes called po natural birth. Some of these techniques include relaxation. Makakatulong po to kay mother to detect the tension para po sa ganon is ma-release niya yung tension na nararamdaman niya. Touch. Ito po yung massage or light stroke to relieve tension. Makakatulong din po yung half bath or shower to relieve pain or tension. Pero bago po gawin yon, mag-ask po muna kay doc. Heat or cold therapy. Used to relax tense or painful areas such as warm towel or cold pack. Surgery. Technique of using the mind to form mental pictures that help create relaxed feelings. Meditation or focused thinking. Focusing of an object or task. Katulad po ng breathing para po mabawasan yung pagka-discomfort. Positioning and movement. Many women find changing positions and moving around during labor helps relieve discomfort and may even speed labor. Analgesics, medication to relieve pain such as meperidine. The next one po is yung anesthesia. Ginagamit po to before gawin ang surgical operation. And then, local block. Ini-inject po to sa perineal area between the vagina and rectum to repair po the tear or episiotomy after delivery. Pundal block. This is type of local anesthesia po na ini-inject sa vaginal area para sa pampamanhid without affecting the contractions of the uterus. And still po, the mother can remain active in pushing the baby through the birth canal. The next one po is yung epidural analgesia. This is sometimes called a walking epidural because the medication infused through the epidural is an analgesic, which is relieves pain but does not numb the body and allows movement. Spinal anesthesia. This type of anesthesia involves injecting a single dose of the anesthetic agent directly into the spinal fluid. This type of anesthesia po is madalas lang na ginagamit for cesarean delivery. Spinal analgesia. Ini-inject po to during labor for pain relief. And general anesthesia. This type of pain relief involves administering of an anesthetic agent that causes the woman to go to sleep. Ginagamit din po to during emergency cesarean deliveries para po di maramdaman ni mother yung pain. And the last one po is yung recovery. Recovery begins during the first 2 to 3 hours after delivery and nagko-contracts po yung uterus to push out yung mga natitira pang nasa loob.
So, before I continue the report, let me introduce myself. I am Josel I. Carbonell from BSN 2B. So, delivery. There is some option for child delivery, like natural unassisted childbirth, assisted childbirth, cesarean surgeries, or C-section. For childbirth location, pwedeng sa bahay, or birth center, but mostly sa pregnant mother, mas prefer po nila yung sa hospital dahil sa hospital kasi mas secure. So next, what is the postpartum care or postpartum period? So the postpartum period begins with the delivery of the baby and placenta. The end of the postpartum period is less well defined but is often considered the 6 to 8 weeks after delivery, because the effect of pregnancy on many systems have resolved by this time, and these systems have largely returned to their pregnancy state. However, all organ systems do not return to baseline within this period, and the return to baseline is not necessarily linear over time. Dahil some of the study po, women are considered postpartum for as long as 12 months after the delivery. So, the postpartum period has been termed the fourth stage of labor and has a 3 distinct but continuous phase. First is initial or acute period. It involves the first 6 to 12 hours postpartum. So, this is the time of rapid change with a potential for immediate crises such as postpartum hemorrhage, uterine inversion, amniotic fluid embolism, and eclampsia. So, gayon din, the first several hours of post-delivery are usually spent on the labor and delivery floor with intense nursing supervision. Space demands often necessitate somewhat premature transfer to the less intensive care of the postpartum ward. So the second one is subacute postpartum period, which is lasts 2 to 6 weeks. So during this phase, the body is undergoing major change in terms of metabolism or emotional status. So, gayon man, the changes are less rapid than in acute postpartum phase. The patient is generally capable of self-identifying problems. So, lastly, delay postpartum period, so which can last up to 6 months. So the change during this phase are extremely gradual, and the pathology is rare. So this is the time of restoration of muscle tone and connective tissue to the pregnant state. Pero the change is subtle during this phase. It is because caregiver need to remember that a woman body is not fully restored to pregnancy physiology until about 6 months post-delivery. The next slide is the physiologic change of postpartum period. So first is the genitourinary change of sonography. So ito yung common na kapag nagbubuntis ang isang babae, then kasama na rin dito yung urine or anal incontinence, pelvic pain or sexual dysfunction, and pelvic organ prolapse. So number 2 is the resumption of mens. So kapag yung babae after niya manganak or then di siya nagpapa-breastfeed ng baby niya, yung mens niya is babalik ulit within 6 to 8 weeks. But for those women who practice exclusive breastfeeding might not have a period the entire time. So number 3 is the pelvic floor support. So during pregnancy stage, yung pelvic floor muscle ng isang babae, ito yung nagsisilbing support sa bladder, uterus, and bowel. It can be only weak during pregnancy. Isa sa mga dahilan yung pagbubuntis is yung prostate cancer, treatment o obesity, and yung straining of chronic constipation. Pero kung susundin ng isang pregnant woman ang pelvic floor exercise, pwedeng ma-improve yung muscle strength niya and to prevent na rin yung mga indications. So number 4 is the cardiovascular change. So dito, posibilidad na tumaas yung temperature on 3rd or 4th day due to the breast engorgement for temporary. Expect na po din natin yung respiratory rate ng isang pregnancy woman will also begin to fall back to the pre-pregnancy level within 2 to 3 days. Usually, yung sign of infection is yung pagtaas ng temperature beyond the 3rd upper limits. So number 5 is the renal change. So renal automatic change of pregnancy is persists for at least 5 days of postpartum. Hang in the breast begin well before So number 6 is the metabolic or the hormonal change. So the metabolic hormonal changes are poorly understood and probably of much greater importance because the change that comes with pregnancy are unique. The hormonal, so the pregnant woman experience sudden and dramatic increase in estrogen and progesterone. Na-experience din nila yung change amount and function of number of other hormones. Estrogen and progesterone are the chief pregnancy hormones. A woman will produce more estrogen during one pregnancy than throughout her entire life when not pregnant. In addition, estrogen is thought to play an important role in helping the fetus develop and mature. So number 7 is the breast change. So during the first trimester, weeks 1 to 12, the mother breast may start to feel swallow and tender. Her nipples may stick out more than usual. So some women find that their breasts start to get bigger during this time. And in the second trimester, 3 to 27 weeks, her breasts will get larger and heavier. She needs a larger bra that gives her more support. She will probably feel less of tenderness and tingling from early pregnancy. So as the mother breasts grow, the veins become more noticeable under the skin. the nipple and the area around the nipple, which is the area will become darker and larger, expecting getting stretch mark on the breast during this stage. So, and lastly, the third trimester, same as the second trimester, her breast will grow some more. She needs a large breast that give her more support. So number 8 is the bone density. It decreases somewhat during normal pregnancy, probably due to calcium mobilization from maternal skeleton to fetal. The effect of breastfeeding on the restoration of bone mineral density is controversial, with some studies showing a continued loss of bone during breastfeeding and others showing the stability at delivery levels. So last is the hematologic change of postpartum. It is a primary change of the postpartum include the acute loss and gradual recovery and red blood cell and iron and sharp of leukocytosis in the first postpartum day.